If you have been watching your diet, cutting back on fried foods, eating more vegetables, maybe even giving up eggs and red meat, and your cholesterol numbers are still high, I need you to know something that most people are never told. It is probably not your fault, and it is probably not your diet. I know how frustrating this is. I have sat across from thousands of patients who come into my office, sometimes angry, sometimes defeated, and they say the same thing. Doctor, I am doing everything right. I changed my diet. I exercise. I take my statin every day, and my cholesterol is still high. What am I doing wrong? And my answer, the answer that surprises almost every single one of them, is this: you might not be doing anything wrong. The problem might be that everyone, including your previous doctors, has been focusing on the wrong things. Because for most people over 60, diet is only a small piece of the cholesterol puzzle. And until you understand the other pieces, the bigger pieces, the numbers on your blood test are unlikely to change no matter how many egg whites you eat. In this video, I am going to reveal the 5 real reasons your cholesterol stays stubbornly high despite your best efforts. These are the factors that most patients have never been told about, and that even some doctors do not adequately address. And more importantly, I am going to give you an action plan with specific questions to ask your doctor that could finally help you get your numbers moving in the right direction. As always, this video is for educational purposes. I am not your doctor. Do not change your medications or treatment plan based on this video. Use this information to have a better, more informed conversation with your physician. That is always the goal. Now let me start by dismantling the biggest myth in cholesterol management, the myth that your diet is the primary driver of your cholesterol levels. Reason number 1, your liver makes most of your cholesterol, and your diet plays a much smaller role than you were told. This is the single most misunderstood fact about cholesterol, and it is the reason so many people feel like failures when their dietary changes do not move their numbers. Your body produces approximately 80 to 85% of the cholesterol in your bloodstream on its own. Your liver is a cholesterol manufacturing factory that runs 24 hours a day, 7 days a week. It produces cholesterol because your body needs cholesterol. Cholesterol is essential for building cell membranes. It is essential for producing hormones, including vitamin D and sex hormones like testosterone and estrogen. It is essential for making bile acids that help you digest food. Cholesterol is not a poison. It is a critical building material that every cell in your body requires. The remaining 15 to 20% of your blood cholesterol comes from the food you eat. That is it. 15 to 20%. So when you eliminate eggs, when you stop eating shrimp, when you give up cheese and butter, you are only addressing a fraction of the total cholesterol in your system. For some people, dietary changes can make a noticeable difference, perhaps a 5 to 10% reduction in total cholesterol. But for many others, especially those whose livers are genetically programmed to produce large amounts of cholesterol, the dietary changes barely register on their blood test. A landmark study published in the American Journal of Clinical Nutrition found that for the majority of people, the liver compensates for reduced dietary intake by simply producing more cholesterol on its own. Your liver has a thermostat. When less cholesterol comes in from food, the liver turns up its own production. The net effect on your blood levels is often surprisingly small. This is why you can eat a perfect diet for 6 months, go to your doctor, get your blood drawn, and see numbers that have barely budged. It is not because you cheated. It is not because you failed. It is because your liver was making up the difference the entire time. Now, does this mean diet does not matter at all? Absolutely not. A heart-healthy diet has tremendous benefits for your overall cardiovascular health beyond just cholesterol numbers. It reduces inflammation, improves blood vessel function, helps manage blood pressure and blood sugar. But if your primary goal is to lower your LDL cholesterol number on a blood test, you need to understand that diet alone is probably not going to get you there if your liver is a high producer. And that is not a personal failure. That is genetics and biology. Reason number 2, Chronic inflammation is secretly driving your cholesterol up. This is the factor that I believe is the most underappreciated in all of cholesterol management, and it is one that I wish more doctors would explain to their patients. Cholesterol is not just floating around in your blood for no reason. One of its primary functions is to act as a repair molecule. When the inner lining of your arteries, the endothelium, is damaged, your body sends cholesterol to the site of damage as part of the repair process. Think of cholesterol like the spackle you use to fill a crack in a wall. The spackle is not the problem. The crack is the problem. The spackle is the response. Now, what causes that arterial damage in the first place? In most cases, the answer is chronic low-grade inflammation. And chronic inflammation is extraordinarily common in seniors. It can be caused by dozens of factors, including excess visceral fat around your organs, insulin resistance or prediabetes, gum disease, chronic stress, poor sleep quality, and sedentary lifestyle. When chronic inflammation is present in your body, your arterial walls are constantly being damaged at a microscopic level, and your liver responds by producing more and more cholesterol to send to those damaged sites for repair. So your LDL goes up, not because you ate too many eggs, but because your body is trying to fix damage. Research published in the Journal of the American College of Cardiology has shown that markers of chronic inflammation, such as high-sensitivity C-reactive protein, known as hsCRP, are actually better predictors of cardiovascular events than LDL cholesterol alone in many patients. This concept completely reframes how we should think about cholesterol. Instead of asking, "How do I lower my cholesterol?" the more productive question for many patients is, "What is causing the inflammation that is making my body produce so much cholesterol in the first place?" Let me walk through some of the most common inflammation sources. Visceral fat. This is the fat that wraps around your internal organs. It functions almost like an endocrine organ, continuously releasing inflammatory chemicals called cytokines into your bloodstream. You can be a normal weight and still carry dangerous visceral fat. Insulin resistance and prediabetes. When your cells become resistant to insulin, your blood sugar stays elevated for longer. That chronic elevation in blood sugar is directly inflammatory to your blood vessel walls. Studies show 40 to 50% of adults over 60 have some degree of this. Gum disease. This one surprises everyone. Chronic periodontal disease creates a persistent source of bacterial infection. Research has consistently linked periodontal disease to increased cardiovascular risk. Getting your gum disease treated could be about lowering your cholesterol and protecting your heart. Chronic poor sleep. If you are consistently getting less than 6 hours of sleep, your body exists in a state of chronic physiological stress. This stress elevates cortisol, promotes inflammation, and can directly increase hepatic cholesterol production. Sleep quality and heart health are deeply interconnected. I had a patient, a 67-year-old woman, whose LDL cholesterol was stubbornly elevated at 165, despite taking a moderate dose statin and eating a very clean diet. When we checked her hsCRP, it was significantly elevated. We found untreated gum disease and early insulin resistance. When we addressed the gum disease and started managing her insulin resistance, her hsCRP came down and her LDL dropped by an additional 25 points without any change to her statin dose or diet. The inflammation was the driver. The cholesterol was the response. Ask your doctor for an hsCRP test. Reason number 3. Your thyroid is quietly sabotaging your cholesterol without you knowing it. This is one of the most commonly overlooked causes of high cholesterol in seniors, and it is one of the easiest to fix once it is identified. Your thyroid gland controls your metabolic rate. When your thyroid is underactive, everything in your body slows down, including the rate at which your liver removes LDL cholesterol from your bloodstream. The result is that LDL accumulates because it is not being cleared efficiently. Subclinical hypothyroidism is common in seniors. affecting 10 to 15% of adults over 60. Symptoms are subtle, a little more tired, a little more sensitive to cold. Many people have no idea, but research shows treating it can reduce LDL cholesterol by 10 to 15%. It is like trying to drain a bathtub with the faucet still running. The statin was pulling cholesterol out, but the sluggish thyroid was preventing the liver from doing its part of the cleanup. I had a 71-year-old patient whose LDL was stuck at 145 until we found his thyroid was the issue. After starting a low dose of thyroid medication, his LDL dropped to 112 on the same statin dose. If you have high cholesterol not responding to treatment, ask your doctor for a complete thyroid panel. TSH, free T4, and free T3. This could be the hidden answer. Reason number 4. You might be taking your statin at the wrong time of day. This is a practical, immediately actionable piece of information that could improve the effectiveness of your medication without changing anything else. And most patients have never been told about it. Not all statins are the same. Some are short-acting and others are long-acting. Because your liver does most of its cholesterol production during the night while you are sleeping, the timing of a short-acting statin matters significantly. Simvastatin, which is Zocor, and lovastatin, which is Mevacor, are both short-acting. If you take them in the morning, the peak activity occurs midday when production is lowest. By nighttime, the effect has worn off. You are missing the hours when you need it most. Research found that taking simvastatin in the evening resulted in significantly greater reductions in LDL, with some studies showing a 20 to 25% difference in effectiveness simply from changing the time of day the pill was taken. That is a free and effortless change. This doesn't apply to all statins. Atorvastatin, which is Lipitor, and rosuvastatin, which is Crestor, are long-acting. They stay active for 20 hours or more, so timing matters less, but consistency is still key. Ask your doctor if switching to evening dosing might help you. Reason number 5. Your doctor might be looking at the wrong cholesterol number. This is the most advanced concept I am going to discuss today, and it is transforming how cardiologists think about cholesterol risk. It is also one that most primary care doctors are not yet routinely using. For decades, we looked at LDL cholesterol level, or LDL-C, which measures the total amount of cholesterol, but research shows it is not the amount of cholesterol that drives plaque. It is the number of LDL particles themselves. This is called LDLP, or ApoB. Imagine a highway. Standard LDL-C measures the total number of passengers. LDLP measures the total number of cars. If you have hundreds of small cars carrying one passenger each, you have more individual vehicles that could crash and cause a blockage. More particles mean more chances to penetrate the artery wall. Having a normal LDL-C but a high particle number is common in people with insulin resistance, metabolic syndrome, or diabetes. Conditions prevalent in seniors. There may be millions of seniors with normal numbers who are actually at high risk. Ask for an apolipoprotein B or ApoB test. Now let me bring all of this together with your cholesterol action plan. Step 1. Ask your doctor about your liver's 80-85% production role. Step 2. Ask for a high-sensitivity C-reactive protein test to assess systemic inflammation. Step 3. Ask for a complete thyroid panel, including TSH, free T4, and free T3. Step 4. If you take simvastatin or lovastatin, ask about switching to evening dosing to improve results. Step 5. Ask your doctor about testing your apolipoprotein B level to get a better picture of your true LDL particle burden. This is especially important if you have insulin resistance or metabolic syndrome. Cholesterol management is not just eat less fat and take a pill. If your numbers are not moving, it is not your failure. Share this video with someone who is frustrated. Subscribe for more heart health information. Tell me in the comments, has your cholesterol been stubbornly high? Thank you for your time. Take care of your heart.